let me just ask you, first of all, so we are learning that the Delta variant is now the dominant strain in California. How worried should we be?
What this tells me is that the Delta variant is substantially more contagious than any other variant that we've had so far. In fact, it is 60% more contagious than the Alpha variant, which was that variant from the UK, which was already 50% more contagious than the original Wuhan variant. And in fact, we also have data that not only is it more contagious, that it may be more likely to end you up in the hospital. In fact, twofold more likely to make you sick as compared to the original wild type version of the virus.
And of course, this is most concerning to people who are unvaccinated. But like you said, people who are vaccinated still seem to be able to get it. So how concerned should people be who are vaccinated?
You know, I would say if you are vaccinated, for the most part, you're quite protected. We have good data that all the vaccines, the messenger RNA vaccines like Pfizer and Moderna, and most recently last week, we just learned that even the Johnson & Johnson vaccine do offer good efficacy in terms of protection against the Delta variant. But it does mean that even vaccinated people need to keep their guard up. And a lot of health experts are now suggesting that this is the reason vaccinated people should continue to mask indoors, because we have evidence that vaccinated people can transmit the Delta variant. Now, of course, the rate of transmission is a lot lower amongst a vaccinated person as compared to an unvaccinated person. But because the strain is so much more contagious, that vaccinated people could be spreading it to others. And perhaps that's one reason why everybody should go back to being vaccinated until everybody should go back to being masked until more of us are vaccinated.
Yeah, well, that kind of leads into my next question, which LA County is urging people to wear masks indoors in public spaces, but the rest of California hasn't given that advice. Is this the right approach?
You know, I think for two reasons, yes, it is the right approach. Number one, a good proportion of people in our country are still not vaccinated. And we're talking especially about our kids. So remember, initially we had been talking about how many people need to get vaccinated to hit herd immunity, and we talked about a 70% number. Those calculations were based on the original Wuhan strain. Now with the significantly more contagious strain, that number just went up, that threshold went up to 80 to 85%, which essentially cannot happen until our kids are eligible to receive the vaccine, which may not happen till later this year. So to protect our kids and to protect, you know, even the vaccinated from the more aggressive variant, this may be a reasonable thing to do. The second reason that it's reasonable to do is because the more you slow down the spread of the infection, the less the variants can propagate. And this Delta variant, thankfully, is sensitive to the vaccines. But if it keeps spreading, our next variant may not be sensitive to our vaccines. And then we're back at the beginning.
Oof, hate to think about that. So I also just want to ask you, so it sounds like it's possible to still get it. You could technically be transmitting it, the Delta variant. Just out of curiosity, like, should we all be expecting at some point in time, even if we're vaccinated, we're going to get the coronavirus? And then we just have to like rest assured that we're not going to go to the hospital or die from it?
No, I don't think that's an absolute certainty. In fact, because these vaccines work so well, I am hopeful that most of us will never, ever get infected with the actual coronavirus, because even vaccinated people, even if they're not in the hospital, they can develop long haul symptoms. They can have complications. You know, they can have problems with thrombosis or blood clots and other such complications from the infection. So because the vaccines are so great, I'm really optimistic that none of us will. Because the vaccines are so great, I'm really optimistic that most of us will not get the coronavirus infection. Now, we don't yet know how long the immunity from the vaccines lasts. So that's a little bit of an outstanding question. We also do not know now with these more contagious strains, because the vaccines were really designed against the original strain, whether or not we may need boosters. So those are outstanding questions. But if we all get the vaccine, we should feel rest assured that it's not a certainty that we'll get infected.
I've noticed just personally, like being out and about in public now, like I am getting like colds or like other things challenging my immune system that I feel like I was spared from the entire past year. And I do wonder, like, I thought we're supposed to get like exposed to stuff every once in a while to have a healthy, strong immune system. Is our immune system or being compromised because we're not getting exposed to stuff now?
So, you know, there's always a question that people have, that if I don't flex the biceps of my immune system, am I really making it weaker? So if I don't get infected, am I making it weaker? And the answer is no, because that's where the vaccines kick in. Every time you get a vaccination, you flex the biceps of your immune system. So when you get your flu shot, when you get your coronavirus vaccine or any other vaccine, you activate the immune system, you teach it how to fight, and it's not getting lazy. So the idea that we have to get sick in order to train our immune system to get stronger is a little bit of an antiquated idea based on a childhood hypothesis called the hygiene hypothesis, which was that when we're kids, we should get, exposed to germs in order to teach our immune system how to fight them. As adults, it really doesn't work that way. And in fact, you can see that even if you've gotten a cold, you'll get it again because that immunity starts to go away. So staying healthy by prevention is always the best thing that you can do. And then if you can't prevent for whatever reason, of course, we want to have our immune system be in best shape to fight it off.